Now it's time to get your questions answered.
If you have a question for Dr. Zorba Paster, the number to call 270-9933, and we will start with Vicki in Platteville. Hi, Vicki. What's your question?
Hi. After my second COVID vaccine in February, I got an inflamed arm. That's what my doctor said. It didn't get better. And then I went in again. He said it was a shoulder impingement caused by the inflammation, and I'm doing exercises for it. I might need PT. Is this common? Is this Zorba? Will it eventually get better?
Well, first of all, it is certainly common to have some pain and discomfort there. And whether or not this is actually caused by the shot, that's a really good question. I can't really answer that. It might be caused from the shot, or it might be a coincidental problem. But we do know that people who have pain from the shot get better over time. And it's one of those things that's a side effect pretty much of every immunization, COVID being one of them, shingles being another one that causes it, tetanus being the most common one that actually causes this pain and discomfort in the arm. Do the PT, follow your doctor's advice.
All right, thank you for calling. Let's go to Barbara in Lone Rock. Hi, Barbara, what's your question?
Hi, doctor. I had 2 Pfizer shots, and then I waited the 2 weeks, and now I'm on like the 3rd week after the 2 weeks, and I am very, very tired. I feel exhausted a lot of the time. And after I had the second Pfizer shot, I did have some chills and some tiredness, but that was just normal. It was no biggie. But is this tiredness that I'm having now, do you think that's from the shot? I'm thinking it might be.
I don't think it's from the shot. I doubt very much of it. People get tired for about 3 or 4 days. I think if you're tired, you're not feeling good, it's been a couple weeks after the shot, that's a time to go see your doctor and see if something else is going on. I would not think it's a shot that is not a known side effect to go out that long. So you ought to get it checked out.
Okay. Let's go to Louise in Monroe. Hi, Louise. What's your question?
Yes, I was diagnosed with pneumonia 2 weeks ago, and I still am coughing, and I can't quite shake it, and I wondered what I could do. I had antibiotics for 5 days, and I had cough syrup over the counter, but I cough not a lot, but every so often.
Sure. Well, there are a couple of things. First of all, if you get pneumonia, especially if you're older, it can take at least 3 to 4 weeks, sometime up to 6 to 8 weeks to get better. Make sure you take fluids, take your temperature. If your temperature goes up, it's the time to call your doctor. Take either acetaminophen, which is the safest, or some ibuprofen if that doesn't work for the aches and pains. And 2 weeks is not a short amount of time after you get pneumonia for any reason. Remember, pneumonia is a common problem, always one of the 10 leading causes of death in any age group. It's got to be taken, respectfully. And once again, if you're not getting better, call your doc. You're on azithromycin if it was a 5-day period, and it actually stays in the body for 2 weeks. Keep with the fluids. Without a fever, you're probably going to get better.
Oh, and thank you.
Okay.
Thank you for calling. Hope you feel better.
Feel better.
Let's go to Stan in Richland Center. Hi, Stan. What's your question?
My question is, are doctors required to take the COVID shots?
Well, in our particular organization, they're not required. I can't talk about other organizations, but frankly, I think it's good for all doctors, all personnel, all health personnel to get COVID shots. It is not required under state law, that's for sure. Individual offices will have their own decisions to make.
All right, Bonetta and McFarland. Hi, what's your question?
Hi, I was calling because I do suffer from blood clots. I have PE. And I had the Johnson & Johnson, the one and done. And it came out that, the blood clots, the people are catching the blood clots and everything. So I have been having like a real uncomfortable feeling like in the lower back part, because I also have an IVC filter in. So I guess I don't know if I should be worried, or is that something that I should talk to my primary about?
Yeah, first of all, the answer is you should talk to your primary. If you've got a filter in the back, that's because you had blood clots. This is one of the treatments for people who either can't take blood thinners or the blood thinners don't work. I'm not sure if having a previous blood clot puts you at risk for having another one. And once again, it is not yet proven that the J&J vaccine is actually associated with blood clots. And if so, the risk may only be 1 in a million. But if you've had a blood clot, for any reason, and you're concerned with pain and discomfort again that you might have another one, it is time to talk to your doctor. Just because anyone who had a blood clot before in their leg is just more likely to get a blood clot again. Just for that reason, nothing to do with the vaccination itself.
Better safe than sorry. All right, we're out of time. Thank you all for calling in. Zorba, thank you for your time.
Thank you, Zorba. Good to see you.
My pleasure. Good to see you guys.
We'll have a final check of your forecast coming up.